So the diagnosis of asthma, the monitoring of sleep apnea, and the aerobic assessment of athletes. What do all three of these things have in common? They all require expensive and specialized clinical equipment and infrastructure to be performed. That's why, at IC Innovations, we're developing disruptive technology to make breathing monitoring and analysis simpler. Our focus is on lowering the barriers to access advanced respiratory assessments and applications ranging from sports to healthcare. I'm Renee Leatherman, and I'm part of the US founding team. The first product, based on our enabling technology, is Chaski, a respiratory wearable system for athletes. While our technology can serve many markets, we decided to start with sports because it allows for faster technical evolution compared to clinical applications. There's lower barriers to entry with no FDA requirements. Customers in this space are high-tech adopters, and most importantly, there's a relevant unmet need to improve aerobic performance. So how do the pros do it? Well, they often go to these specialized sports medicine clinics and get a smattering of cardiorespiratory tests. Their coaches then take the output of these exams to design customized and individualized training programs to meet their needs. And this can lead to a 2.4 times increase in performance compared to mass market alternatives like smartwatches. However, this isn't really suitable for the everyday athlete. First of all, it's expensive and often not reimbursable. It's time-consuming. It can take weeks to get an appointment at one of these labs and hours out of your day to get this test done. But most importantly, it's uncomfortable. This is a clinical test that most athletes don't want to ever do again. So we thought, how can we democratize the pro sports assessment and enable all athletes to have the opportunity to improve their aerobic performance? So we developed Chaski, the first respiratory wearable device for athletes that enables you to take the lab with you everywhere. Chaski is made up of a wearable device that's comfortable, lightweight, and portable, a mobile application that displays intuitive and real-time respiratory metrics, and a performance analytics platform for advanced respiratory analysis. With Chaski, you're able to test conveniently. In under 20 minutes, you can perform a performance benchmark test. You'll get an advanced report where you and your coach can design personalized, individualized, data-driven training for your unique goals, just like the pros. And with Chaski, you're able to measure compliance to that programming in real time, making sure each training session is as effective as possible for your goals. Our secret sauce lies in the disruptive way that we monitor breathing and assess aerobic and anaerobic thresholds, as well as other respiratory metrics. With Chaski, you're able to get gold standard metrics in a wearable form factor. We have a patent for our device in China and pending in the US, and our proprietary algorithms are under trade secret. Our initial beachhead market is coaches of amateur endurance athletes. These coaches and athletes understand and know how to use this type of data and insights, so our value proposition resonates easily with them. We estimate this to be 10 million people, or $3 billion a year, considering costs of tests and the device. Currently, we have over 20 B2B customers in 5 countries who have performed over 700 activities with Chaski. These range from the coaches of endurance sports teams and clubs to private performance coaches who have independent athletes. Our team is made up of Vader Johnson, an entrepreneur with over 12 years of experience in medtech, Daniel Hurtado, who's a visiting professor at MIT and has been awarded by the World Economic Forum for his research in respiratory biomechanics, me, Renee Leatherman, with over 8 years of product experience at leading tech companies, and a diverse R&D team covering the areas from sports science to supply chain. With our capabilities and our technology, we plan to continue to lower the barriers to access respiratory insights in sports, wellness and breathwork, and clinical applications. We entered the US market 6 weeks ago, and we're looking to build our network and partner with innovative coaches and teams. So please share our information. Thank you.
Great presentation, thank you very much. First question is, you have IP in China, right? So you know you're going to get that question. What does that actually mean, and what does it mean in the US or in European markets, and who actually owns the IP, and do you have an exclusive right for this application or anything else? Like, what is the relationship between your, I think you call this US founding team, versus the actual technology development over in China?
Yes, so the company started in Santiago, Chile, and we've been in the market in Santiago for the last year. The company was founded a few years ago, and all of the IP is held by our company and our team. The research came out of labs in Santiago. We're entering the US market as the market opportunity is a lot bigger in the US when it comes to endurance athletes and sports in general. We filed patents in the US and China from a strategic position, wanting to have our IP protected in the US and China as well, and their China will protect patents and IP. So because we do get some parts from there, we thought it would be smart to cover our basis as well in China. And as of right now, have not filed any patents in Europe, but from our US patent portfolio and strategy, that may be down the line, but for now, the US is sufficient for us.
How close to the gold standard is your measurement?
Yes, so we have validated our bike protocol to monitor respiratory frequency and thresholds, and our error for respiratory frequency was under 5%, and the assessment of ventilatory threshold was under 10%. And that paper is being published.
And the last question was, so you set a market size, I think, of $3 billion a year for 10 million users, so $300 a user a year, plus minus. How does that break down? It's like, how do you actually sell it? You touched on it, but maybe break it down even more, how each dollar kind of trickles through that waterfall.
Yeah, sure. So the $3 billion, there's actually a bit of a more intricate calculation and assumptions behind that because of how, what we expect as usage and lifetime value of customers. So I'm happy to show you that spreadsheet afterwards if you want to see exactly how the assumptions we made in the market valuation there. And how we sell this right now is to coaches. So coaches will buy the device. The device enables you to get real-time respiratory metrics, and then there's a subscription model. So depending on their needs, how many tests they plan to do, usually you would test an athlete every 6 weeks or so to customize your training, track progress, make sure you're moving towards the goals. The subscription essentially enables a certain amount of tests a month.
And just give us some kind of number, like what is the cost of the device?
Yeah, sure. So the cost of the device is $999, and the different subscription tiers have different pricing based off essentially how many tests you're going to do a month. And this is really focused on coaches who right now are sending their, if they're sending their athlete to a lab, they're paying $250 to get one of these tests done. So it enables them to have a new line of business for their athletes, as well as performance centers are also able to spin up a new line of business and do pass-through pricing to their clients.
And just continuing on that path, is the device athlete specific, or is it something that can be sanitized and used by one coach across multiple athletes?
It is not athlete specific. So a coach can have one device, they can use an alcohol wipe, clean it, and use it for the next athlete. And this is actually one of the big advantages, because generally if you're performing these types of tests or you're buying some, ergospirometry equipment, not only are they tens of thousands of dollars, but you need a specialized person to actually run that test. But with Chaski, a coach can be, if they have 2 devices, they can be testing 2 athletes at once. It's very lightweight to run a test, or they can, have a couple athletes come in one after the other. There's no sort of recalibration time or downtime. So a coach only needs 1 device to be able to provide value to their whole team.
And are there very specific test parameters that you give to the coaches, exactly what you need the athlete to do, run for 30 minutes, bike for, and is that customizable based on other sports?
Yeah, so what we have are called protocols. So you would do a ramp test protocol, less than 20 minutes. And after that test, you will be able to get that advanced report that I showed. So that is a structured step-by-step protocol. We have one for cycling and we have one for running. And within those, based off athletic ability, there's a male elite, male amateur, female elite, female amateur, etc. And right now, those are treadmill or like a turbo trainer bike. However, we do have a coach we're partnering with who is using LED lights to implement that on a track. Because one of the big advantages of Chaski is you can actually test in the environment that you're performing in. So you're not going to a lab with a very controlled environment and trying to understand the performance of your athlete as they're wearing a huge mask. You can have a device that's not really impacting breathing outside in the elements and weather that they're actually going to be performing in, and do your benchmarking test.
And if you want to take it beyond endurance sports and you wanted to take it to ice hockey, which has different parameters and needs, or the NBA basketball that has different parameters and needs, would that require a lot of work on the back end, or would it be a similar test based on those environments?
Yeah, so what's interesting, because we have been speaking to a lot of those sports, like soccer as well, is usually the coaches, the goal will be different, right? They'll want this data and they'll want the output of a benchmarking test, but they may be trying to enact different physiological changes in their athletes. So they're going to program training that's spending time at different intensities for this unique goals. So right now, if a basketball coach or ice hockey coach wanted to use the device, we would have the athlete do a running protocol test to assess these thresholds, and then the coach would design unique training based off that sport and what the goals are or the physiological adaptations you want for that athlete in that sport. We do want to expand and make it even easier for athletes to test, and that process would look like coming up with a protocol and then making sure we do a validation study, because everything we do is going to be backed in science and validated. So that's what that process would look like.
Great. Question for you about, you've got hardware, you're talking about a subscription. Help us understand a little bit about the ongoing data analytics. I mean, if you're doing a performance test, that's pretty standard. What is the value of the ongoing data analysis? Is that even a key part of the solution?
Just to clarify your question, when you say ongoing data analysis, do you mean being able to see real-time respiratory metrics and insights of the athlete?
You have a subscription model.
Yes, yeah.
But you are still doing episodic testing. And so I'm trying to understand if there's an ongoing process that seems to lend itself more to subscription model. So I'm just trying to understand the relationship between, you've got hardware, you've got data, and you've got a subscription model. Why have you built it that way? Is there any analysis that's going on over time that requires you to be live connected to, to the cloud to do real-time analysis? And if it is, what is it?
Sure, yeah. So we kind of think of Chaski being used in 2 ways. Chaski for evaluations, like doing that benchmark test that we've been talking about, and wearing Chaski when you're training, when you're going for a bike ride or a run. And when you wear Chaski when you're training, what you'll be able to see is in real time your respiratory rate. And this is a very good global indicator of the internal load that is on your body when you're exercising. So what we see elites doing is while they're doing a workout that their coach has prescribed at a very specific intensity, they'll want to ensure they're exactly at the intensity that the coach has prescribed to make sure they're getting the right physiological adaptations, but not accumulating fatigue. And so that's how Chaski's used in the field, is athletes can wear it when they're executing a ride or run, and they can base they can adjust their intensity on the fly based off that respiratory rate output.
Okay, so that's a different use case than the one that we've just been talking about with the coaches having regular testing with multiple clients. So would that be something that you would sell direct to the athletes, and they might use the device on a regular basis, for their daily training?
Yeah, so we definitely, so usually if you're an athlete, your coach knows how to program off this data and what this data means. So we do have use cases where coaches have a handful of devices and they're training an athlete, and one of their offerings from their business model is to be able to have the athlete wear Chaski during specific workouts, especially with endurance sports, these lower intensity workouts where the coach really wants the athlete to stay in a very low intensity, to be able to wear it during those workouts to ensure compliance. We have spoken about going more of a consumer route at some point, but right now the market education isn't really there for a given athlete to really understand how to use these metrics for themselves. So over time, we do see that as an opportunity we can pursue.
Great, thank you very much.
Thank you.